morning, good afternoon, everyone. And thank you for being here today. First, I apologize for the technical issues. I'm just going to introduce Dr. Amber now. So Dr. Amber Mehmood is a trauma surgeon. She's currently leading the Global Disaster Management, Humanitarian Relief, and Homeland Security Program at the University of South Florida College of Public Health, USA. She's a public health academic with over 20 years of experience implementing and monitoring health programs, focusing on emergency and disaster management, health system strengthening, trauma care, injury prevention, quality of health services, and health outcome-based research. Dr. Mehmood has previously served as the Associate Director at the International Injury Research Unit at Johns Hopkins Bloomberg School of Public Health, Baltimore. Her teaching and research portfolio covers a breadth of topics in global health, disaster management, injury surveillance, healthcare disparities, and monitoring and evaluating healthcare interventions. Dr. Mahmood used mobile health tools to develop hospital-based digital trauma registries implemented in Oman, Kenya, India, and Uganda. She also helped develop a framework for prevention and control of occupational injuries in migrant workers of Qatar. Over the years, she has collaborated with academic institutions, biomedical researchers, national, governmental, and international organizations to support and enhance global health programs and develop capacity to strengthen health system. Thank you so much, Dr. Amber, for being with us. The floor is yours.
Thank you for this kind introduction. I want to say that, this has been quite a journey from being a surgeon to a public health professional working in trauma emergency care and then moving to disaster management. I am very much involved in community-based research now and capacity development in terms of disaster preparedness, both in communities and in healthcare workers. So thank you. Summer, can you share the slides, please? Thank you.
Okay, can you see it now? Okay.
So just next, yeah. So just, I want to make sure that, we start with some common ground, like, what do we mean by disasters? Why we call certain things disasters, other things emergencies, and certain other things catastrophes. And also, I want to introduce you to a broader, way of thinking. We call it systems thinking. And it gives you a broader sense and certain tools to employ when you are planning, preparing, and responding to disasters. So let's start with the classification of disasters and scope of the problem. Next. So I want to emphasize that, disasters, when we use this term, it means that we fulfill three elements. One is there is a disruptive event or phenomenon. We all know that. But also there is some kind of vulnerability to the event or phenomenon. Vulnerability could be in terms of local assets, local people, property, economy, etc. Can we go back? It's moving on its own. And impact means that, when we say a disaster has happened, it means that the impact was so powerful that it overwhelmed the local capacities to cope. So that makes it different from emergencies. Like, you see fire emergency, you see road traffic emergency, that can be managed with local capacities, but disaster require, a larger set of resources. So next. We also know that disasters are very diverse. You know about disasters more than I do in Lebanon. And, it could be man-made disasters. Natural disasters are rising because of climate change. And, and additionally, we are now entering into an era where AI and cyber threats are also increasing. So, dependence on technology, certainly has its merits, but also some downsides. So we are very aware that, the way we have created the society, which is very industrious, very technologically advanced, there are certain risks related to that, and that will expose us to not only increasing levels of natural disasters, but also increasing levels of man-made disasters. Next. So I just wanted to make sure that everybody understands that emergency disaster catastrophe is a continuum. Emergencies are mostly everyday emergencies that we manage with the help of our fire departments, our police. Community disasters is when it requires external resources, external to the community. Which means it could be from the regional level, it could be from the national level, and catastrophe is something that requires international level intervention. Um, you know about the Beirut blast, but we also know about, Katrina in United States, which required a lot of, different nations to step in and help us. But then there is an extinction level event, and God forbid that happens. It means that the whole society, its components would be at threat, and it would be an existential threat. So these are just different levels of how we classify disasters, and it is a continuum. Next. So this is an older data until 2020, but you can see that this is only addressing the natural disasters, and natural disasters like, meteorological disasters or climate-related disasters, including flood, drought, storm, is not only increasing, it's actually, impacting more and more people around the world as more people are concentrated in cities and in urban areas. And, population is obviously increasing too. But, the vulnerable population, whether they are in, high income countries or in low income countries, are more and more, exposed to natural catastrophes like extreme temperatures, droughts, storms, hurricanes, etc. But at the same time, let's go to the next slide. I also want to expose you to this terminology, which is called complex humanitarian emergency. And many times I hear that this, about different disasters, saying that this is a complex humanitarian emergency. And I'm like, no, because, for a humanitarian emergency to be classified as complex humanitarian emergency, there has to be an element of political, civil, and government instability. For example, if an earthquake hits Ukraine right now, or in Afghanistan, there had been earthquakes and storms, etc. So in the context of when there is internal conflict and associated with large scale displacement of people because of that conflict, and then a disaster strikes, that is called complex humanitarian emergency, because now you have serious security issues, serious access issues, political rivals on the ground, and the response and delivery of aid to the people who require it not only require multi-sectoral and international interventions, but also is faced with a lot of security and access issues. So I just wanted to make sure that everybody is on the same page about these terminologies. Next. Uh, uh, it is also important to remember that most deaths during complex humanitarian emergencies are due to preventable causes. They're not due to the disasters. We are looking at it in Gaza right now. Sorry, because, Gaza, in addition to the conflict, is also facing access issues, access to humanitarian aid, political instability on the ground, famine, complete disruption of healthcare system. So this is why complex humanitarian emergencies combine displacement of people, food shortage, fragile or failing institutions, and access and security issues. Next. Now, another important concept is the definition of mass casualty incidents. And I tell you that not all disasters are mass casualty incidents, and not all mass casualty incidents are disasters. In United States, we see a lot of mass casualty incidents in the form of mass shootings. So there is no, structural collapse, fire, other things, but there are a lot of people who are injured. So mass casualty incident is an incident where the number of casualties exceed the ability of medical teams to provide quality medical care. So, it's completely in terms of how do you provide care to a large number of casualties, and it is a function of capacity and capability. Like, I am, in a hospital where there is no neurosurgeon. So even though I might have space, I might not be able to treat head injured patients, so on, if they are in large numbers in large numbers. Next. So any situation where existing resources do not adequately meet the resource needs, for example, it could be pre-hospital capability, emergency services, like, rescue, search and rescue might not be possible. Or, healthcare facilities do not have enough healthcare providers or space to accommodate all those, injured people. So then it is called a mass casualty incident. Next. So the next question that, we need to take head on is that, are disasters unpredictable? And can we prevent them, or they are not preventable at all? So my answer to that is disasters, for example, caused by natural hazards, may be unprecedented, but not unpredictable, right? If we live in Florida, we have a hurricane season. We start preparing in the month of May, and the hurricane season lasts until end of November. So for 6 months, we prepare for this natural hazard that could strike us. So there is an element of predictability, but also preventability, because we cannot stop the hazard itself, but we can stop people from being impacted by the hazard. So while the hazard stays, the disaster could be prevented. So we need to understand the differences between hazard and disaster also. That, there might be a hazard, but our actions, our preparedness, our planning can prevent that hazard from turning into a disaster. So this is why we call disaster risk. And with each hazard, there is an inherent risk of disaster, which is defined as the likelihood that damages will overwhelm the ability of the affected community for a specific period of time. And it is a function of hazard, exposure, vulnerability, and capacity. Now, I would take 30 seconds to illustrate this point. Hazard is a hurricane, let's say, or an earthquake. Exposure is whether you, as a society, buildings, people, assets, are exposed in the path of that hazard or not. So we have hurricanes. Every year, the hurricane path, there are multiple hurricanes, and every hurricane has a different path, right? It passes through certain areas, leaves behind certain areas. So the people who are in that path are exposed, the others are not. Okay, so it also means that, hazards has the, there is a potential whether people would be exposed or not. for the same hazard. And then vulnerabilities. Vulnerability could be in terms of, the social vulnerability. You are living or you're living in coastal area, or you're living in low-lying areas where there is a potential of flood. And also capacity. Do you have enough shelters to evacuate those people? Do you have enough resources to make sure that you can care for them when before and after the disaster strikes? So all of these things function together to determine whether the risk of disaster is higher in Tampa than in Miami, or because you guys don't have hurricane, so you are not exposed, right? Hurricanes exist, but you're not exposed. So this is some of the concepts that I wanted to make sure we all understand. So next slide. So I think I explained all of this. Hazard is a process, phenomenon, or human activity that may cause loss of life, injury, death, impacts to the property, damage, social or economic disruption, etc. So that is a hazard. We all saw that COVID-19 was a hazard too, right? Exposure is a situation of people, infrastructure, healthcare services, and other services that are located in that hazard-prone areas. And vulnerability is the condition determined by the physical, social, economic, and environmental factors. And it may increase or decrease the susceptibility of individuals, community, assets, or systems. So risk is a combination of hazard, exposure, and vulnerability. Next. So next we will talk about some concepts of disaster management and systems thinking in disaster management. Let's go. So disaster management cycle, we call it a cycle. Sometimes we are not out of one phase, but still we are preparing. So there are four distinct phases. Mitigation is when you are trying to lessen the impacts of hazard. So for example, if people are living in an earthquake hazard area, you try to build buildings that are earthquake resistant. You create infrastructure that has certain building codes that prevent them from, from creating fragile structures. So that is mitigation. Preparation is when you know it will come, so we better prepare. And preparation means that you would prepare the systems, you would prepare the communities, and you would create resources and systems that will help you in facing that disaster. So that is pre-impact. Response, we all know it, when the event hits, you have emergency response and you have continuous response, and you try to restore and reconstruct during recovery phase. So these are four phases of disaster. Sometimes you are not out of one phase and you are into another. So for example, in hurricanes, all the time, we are not even recovered and we start preparing for the next. So, or sometimes we are in 2017 when 3 consecutive hurricanes hit, the Atlantic basin of United States. It was like almost simultaneous. So we were not out of one hurricane and actually got into another. So Hurricane, Maria, Harvey were like only 5 days apart. So it could be full, a fallacy that you complete one phase and then enter into another. But in reality, these are going side by side. We have to remember that these phases are important. You have to mitigate, you have to prepare, you have to respond, and you have to, rebuild and recover. So next. So emergency preparedness and planning refers to systematic process of organizing resources, procedures, and strategies. So it's not like, I think that since I am safe in my home, it means that I am prepared, or my community might be prepared. It's a systematic effort by the communities, by the government, by other institutions to prepare and plan for the hazards that we have in our in the foresight. It also involves anticipating potential hazards. So you may have to do a hazard assessment before you plan, because that will help you identify the potential risks, and it ensures that communities, organizations, and governments are ready to respond. So next slide. um, Preparedness and planning involves developing plans. So you must know that if hurricane hits my area. Last time it was in 2022, Hurricane Ian. Um, we lost power for 5 days. So, but you had the plan, the contingencies about how would you restore power, how would you make sure that the people who are evacuated, who needs evacuation, are evacuated in a shelter, and all those things are plannings and procedures, and it includes conducting drills and exercises, training personnel, and stockpiling necessary supplies. So if you do not have necessary supplies, you won't be able to sustain. For example, we prepare for 7 days for each hurricane, for example. So, 7 days at household level and several weeks at the government level. So, you need those kinds of resources. Next. And disaster response phase obviously includes the activation. There has to be a declaration that this is a disaster, okay? Otherwise, like I said, that it is a continuum. So if local people think that this is a disaster, but the government doesn't think it is a disaster, then the response would be disjointed, right? So you need some trigger points saying that when these 5 things are fulfilled, we will activate the disaster response, and then you implement the response. You simultaneously mitigate the hazards, because as you are responding, you find more hazards, and you should have procedures in place to mitigate and then recover. Next. I also want to make sure that we understand that disasters are caused by a combination of physical and social processes. There are interdependencies, between human systems, uh, ecological or environmental systems, and the way we live. Okay, so for example, if all of my my home, for example, I mean, everything is dependent on electricity, water, stove, internet, whatever it, and then that is dependent on some other outside company that provides that. So we are in living in an interdependent society where environmental factors, physical factors, social factors all combine together to make you more susceptible or more resilient to disasters. And the adaptations and adjustments that we do in the system um, determine whether we will be able to recover, or recover and bounce back, or we would be, come out from this disaster even more vulnerable. Next. And same, thinking about the same concept, that it's not like, in our country, we have Federal Emergency Management, agency, which is called FEMA. Everybody knows about FEMA, but it's not only the job of FEMA, it's a multi-sectoral effort that requires communities, that requires climate and environmental protection, that requires logistics and supply chain, which is, another set of um, uh, people and industries and logistics. We have health services, and we have pre-hospital search and rescue. So all of these people come together to mitigate and respond when disasters are anticipated. Next. We also know that as the world is becoming more and more connected and more technology dependent, we are insufficiently prepared for an increasingly complex environment where everything is interacting with each other. They are interconnected. One thing falls, and it affects another industry or another sector, and that sector is also affecting another sector. For example, if earthquakes um, doesn't do anything to the people, but causes massive disruption in transport or road system, then what will happen? Obviously, your maybe transport of goods, of fuel, of food might be affected. It may require, and just think down the line. If fuel is not available, then what will happen? If food is not available, then what will happen? So, even disruption of a major highway can cause cascading effects down the line. So this is what we need to understand. Next slide. So this is just an illustration that, everything is connected, from Wi-Fi, from industries, from, um, uh, electrical lines above and under the ground, stock exchange, your financial systems and institutions, and academic institutions, and industry. So everything is sort of connected, and this is the complex environment that makes it so much difficult to plan and prepare for disasters to come. So next slide. So again, we cannot see threats and risks in isolation. We have to think about that. If this happens, what other sectors or people or industries would be impacted? There are, feedback loops between them. So if I pass a building code today that requires building to be built in a certain way, it will impact, possibly the construction business. It will impact your, vulnerability during a disaster. It will impact probably the land use of that area, and may probably cause more coastal erosion. I don't know. So, one action in one sector may have various feedback loops that impact other sectors as well. And also healthcare. Yes, next slide. Healthcare system also has a lot of interdependencies. So, hospital site, many of your hospitals got impacted in that, Beirut blast, although they were not in that, port area directly, but they got impacted. And, the communications were impacted, the supplies were impacted, the built environment might have some vulnerabilities, like, some hospitals are built in floodplains, and there is always a flood risk. And we think about what will happen if the flood happens and impacts all the basement structures, which are usually the lifelines, the water supply, the electrical supply, the servers, everything is in the basement. So what will happen then? And then hospitals' organizational vulnerabilities. If people are injured themselves, or if there are all, a certain type of specialists or healthcare providers, and not trauma surgeons. Or, if everybody, that next year this hospital's half of nursing, leadership will retire, then what will happen? So, there are certain interdependencies within the healthcare system too that we have to keep in mind when planning and preparing. Next. So, what is the implication of systems thinking, and why I, keep on talking about it continuously? The important thing is, when we apply systems thinking approach, one thing that is very important is learning from our past mistakes. Because there could be mistakes, but there could be good lessons to learn also, that, okay, this thing worked, and let's make it a part of the plan. Because, it was not a part of the plan, we tried it, it worked, so let's do it. Then also in understanding the system's ability to adjust and adopt strategies. So if I say that from next year on, there would be disaster drills. Okay, I made a strategy, but there has to be an end goal, right? Uh, what does disaster drill do to the people? Are they prepared? Are they taking it just another task on their schedule, or it serves them in a way that they are adopting it, changing their behavior, planning for themselves. So, or the disaster drill that we conducted for so long is just for fire hazards. And we are doing it for years, but now we have different kinds of hazards. So, continuously thinking about changing system, changing threats, and adopting to them. And then it also requires engagement with a diverse range of stakeholders. If we are talking about healthcare providers, you may want to, you might not have thought about collaborating with engineers or architects or, security personnel. But now you have to, because this is a new threat that you did not think about. So, and then also understanding that the behavior of a system. Let me pause here and let me talk about the behavior of the system for 2 minutes. You know that Beirut blast, and I commend Summer, because she has written papers about it. I haven't, so she knows better than I do. But I want to take a pause and say that, that ammonium nitrate that was stored in that port warehouse was a system failure, because it was stored there. There was nobody accountable for it, nobody responsible for its disposal. Nobody took care when people actually highlighted that, this is a hazard sitting here. We will be, in a great risk. So tell us what to do. People actually reached out to court and other authorities that we want to do something about it. But the system behaved in a way that there was nobody responsible, there was no policies or procedures in place on how to deal with that kind of hazard or threat. And then there was no responsible people. So the whole system was created, was responsible for creating this, huge mess, because the policies, standards, strategies, legal frameworks towards disaster risk reduction were not there. So you cannot pinpoint one person that this is problem, this person is the problem, this security guard matched the lighter there, and it happened. No, um, um, that is just a proximate cause of that disaster, but there are distal causes, and we have to keep that in mind. And then obviously discover and represent feedback processes, listen to public opinion, see the source of fundings and legislations, and identify stock and flow relationship, which means that um, uh, there are some structures which are there, but the interaction between those structures are dynamic. Some institutions might be working together now, but they were not working together 4 years ago. So, that dynamic has changed. So how to leverage those dynamic relationships is also important. So next slide. So the other thing, I think we have done this. No?
All right.
Okay, so again, important thing is decisions made by one sector can impact another sector. So if if the port authority decides today that this kind of materials will not be stored in this area, then it will impact other sectors. That what will happen when certain things, when certain materials, we encounter certain materials. Do we need another storage facility? Do we need another policy, procedure, protocol to be developed for that kind of things? And obviously, we require collaboration among various agencies, organizations, and sectors. Next. Another important part that I want to emphasize is involving communities in every step of the way. Because I don't think that disaster management is just a top-down, phenomenon. From mitigation to preparedness to response and recovery, engagement of communities is so important, because at the end of the day, you want to protect your communities, keep them healthy, make them safe in the face of the hazard. So engaging with them in mitigating certain hazards, in preparing them for response and recovery is crucial. So nothing can succeed if communities are left aside and decisions are made only in government and non-governmental sectors. So next. Another thing, disasters are just trigger points that expose existing injustices. We know these injustices are there. Disasters just, expose them. There is social injustice, there is climate injustice, and environmental injustice that triggers, that may become exacerbated, or it is already there and disaster just exposed. So for example, a lot of times when disasters strike, it's the low socioeconomic poorest of poors who are impacted the most, right? Those people who cannot afford good housing, those people who cannot afford to evacuate in time. They don't have transport. They don't have money to go to a shelter or hotel. So those are the people who are going to be impacted. Those people who are fishermen, live in coastal areas. So disasters just manifest those injustices in a broader and more highlighted way. Next slide. So where should this understanding lead us? Important thing is putting communities with their social, political, and physical assets at the center of public health practice and research, and do applied research, like, not just theoretical data collection, but actually research that serves the community. And move towards a systems approach, because unless we take a broader view, a broader lens of looking at the systemic of the problems, we won't be able to change the system that leads for certain hazards to become disasters. And then application of system science methods like systems dynamic, I talked about, network analysis, who is connected to which person in what way, what institutions work together, what institutions don't, can we find some leverage points and introduce some interventions that can improve the situation. So all these things sort of, take us away from our traditional models of, cross-sectional studies or like, randomized trials that we do so often in healthcare. It's more about understanding the system and how it works. Next. And also incorporating equity and justice as the central theme in each phase of disasters will build the required resilience in the community. Next. So in summary, disaster risks are conditioned by societal perceptions. If you don't perceive that this is a risk, you won't prepare for it, right? Nobody thought that, that warehouse would blow up someday. Nobody perceived it as a risk. So risks are conditioned by societal perceptions, priorities, needs, and demands. And the decisions that we make and practices we adopt will be guided by what we consider hazards and risks and threats, etc. Also, hazards evolve and people's vulnerability change over time. So we need to understand those dynamics in even in disaster risk, and the system should be able to respond to different preparedness interventions and needs in that context. We also need to integrate planning and preparedness that goes beyond individuals and sectors. So disaster management is not an emergency response sector's problem. It's a whole society problem. So unless we develop that kind of understanding, we would not be able to do much. And then sustainable healthcare should be based on interdisciplinary research. Um, uh, because I'm sitting in a room full of doctors and public health professionals, we need to understand that the success as a society would be more pronounced if we start working with different disciplines and sectors, and even involve them in our research, and and base that research on local issues, local problems, and emerging problems. I there is This is considered almost a buzzword that there are emerging threats, but there are. So, we have to prepare ourselves for the emerging threats and problems, while not taking our focus away from traditional long-term issues. So I thank you for your attention, and I'll be happy to respond to any questions.
Thank you so much. Thank you so much, Dr. Mahmoud, for this comprehensive and detailed presentation. It's pretty insightful and very reflective of our many of our situations here in Lebanon. Okay, so I'm just going to open the floor for questions. So if you have any questions, please unmute yourself and just proceed with the question. Okay, I think I'm gonna start by asking question myself here. I think it's obvious from your explanation that the more complex the system is and interconnected, the higher the vulnerability, the more impactful the influence or impact of any of these disasters. So I was wondering, like, how to kind of balance out these, interconnectivity and complexity of a system, especially in places with prone to higher rates of disasters. This is one thing, and the other thing is like also as we have different types of drills that are tailored to specific disasters. So I think different places around the globe would have specific types or the tailored drill to really train on or accommodate for that?
I think this is a great question, Summer. The first thing that we do in disaster management is to create a hazard profile of the community. Like, if we live in a certain area, or if we live in a certain region, then we need to know what are the hazards more prone to that area, first of all. And then what are our capabilities to deal with them? so that we can, and when we say that we create a list of hazards, we also try to connect, to create, certain, um, uh, let's say, certain pictures in mind or certain scenarios. So we call it scenario modeling, that if this happens, okay, then it will impact this sector, this structure, these people. If it is like, happens to a certain intensity. So, for example, my house, I'm sitting in my house right now, um, is able to stand level 4 hurricane. Okay. They say it level 5. We have not tested it. There was no level 5 hurricane so far in this area. But, we have tested it that this house can stand on its own without a scratch, with a level 4 hurricane. So, when you say that, but what would happen if a level 5 hurricane hits? So, so you create a hazard profile, you create a profile of what happens when it impacts, and then you create an understanding of what is our capabilities or capacity to deal with them, and then find the gaps. So, find the gaps where what is not covered. So, for example, in past 3 years that I've moved here, there is a great influx of refugees in Tampa. And refugees coming from Afghanistan, from Ukraine, from Africa have not even seen an ocean, let alone a hurricane. They live in landlocked countries. So, preparing them for her. So we found a gap. We thought that, this community does not understand preparedness, and does not understand preparedness for various reasons. There is language barrier. There is a trauma that, refugees bring with them and are not able to prepare. So we help them preparing for this kind of hazard. So, like us, like you said, that, the community drills and exercise and preparedness can be sort of, tailored for the community needs and for the hazard profile. If we have done this fire extinguishing exercise for years, that's good. I hope that by doing it every year now, the people know that, this can be done. But what if there is a terrorist attack? And that happens in my part of the world too, because, there are instances where entire hospitals have been locked down because of armed gunmen have stormed. So, there is a new kind of threat. So let's prepare for that. So it's a continuous thinking process, and continuous evaluation of not only the risks, but also the capabilities that helps, prepare for the emerging threats and the new threats that occur in a community or a region.
Right. Thank you so much for your response. Okay, so let me see, please, if you have any questions, please just go ahead.
I see a question from Amal. From your experience, what modalities can be used to enhance community participation? I think this is great,
Yeah.
because this is kind of my passion too. So one of the things that I have done, and I have, I have tried many things. I have actually gone door to door, especially the refugee populations, to prepare them, provide them with resources, provide them with brochures, everything in their own language. I have, we went there with translators. We conducted classroom and, like a classroom type or group teaching. And I think the best that worked was group teaching, groups, preparing communities in a group for two reasons. A, you expose them to the kind of, hazard profile that the community might not have even perceived as a hazard. So you expose them as a community, You provide them resources, you provide them knowledge and skills about how to prepare for 7 days, emergency kit, how to locate your, emergency exits. What is this area's emergency shelter? How would you get there? How would you know you have to evacuate? So, preparing a whole community in small group settings is more effective than going door to door and telling them alone. Also, it creates a sense of camaraderie and connection that, oh, we are all all together in it. So let's exchange phone numbers, let's share resources. I have transport, I can take you during an evacuation to the shelter, or you can leave your children with me while you go out for because there were community emergency response team members too in those groups. So that is very important. The other thing that is important is to make sure that everything is explained to them in their own language and not using jargon. Nobody would understand the complex terminology that emergency managers use. Tell them in their own language and understandable terms, and also keep the culture in mind. A lot of my refugee clients are very wary of going into the shelter because they think that their privacy would be compromised. Shelters are not segregated in male and female. So how do we create those structures? So I think, keeping cultural, religious, personal preferences in mind, creating a network of people who have each other's back, and exposing to them to the resources that are already available, and also encouraging them to create more resources for their own community. Like, many people say that, oh, you can use my garage for storing these items, and or you can use my truck while we stockpile these things. So identify the community assets, make them available for everybody, and create a network of people who can help each other is the best modality in enhancing community preparedness.
All right. Thank you so much. Okay, so let's see if I would just like first ask you just, okay, please mute your mic. Okay, so any other questions or any other comments? Okay, I think we're approaching our end time right now. So if no further comments or question, I'm just gonna thank you again, Dr. Amber Mahmood, for joining us this morning and for presenting this quite an interesting and very contextual topic for us, and also from early morning in Florida. So I thank you so much for your time. Thank you everyone for joining, and we'll see you next week. So thank you so much, Amber, again.
Thank you, Summer. It was a pleasure.
Thank you. Have a nice day. Thank you, everyone. Bye-bye.